So I've been on the fire department for 20 years. 17 of those 20 years I've been a medic, and my entire 20-year career we have never had a trauma center here in the county. We would always have to go to neighboring jurisdictions to get the injured person, the injured patient, to definitive care. Having the ability now to transport a person in county to a trauma center is huge.
So the hospital has served Arlington County for years, and the county has watched the hospital grow, and one of its latest additions is the trauma program. And I think that they are very invested in having a trauma program here to serve the citizens of Arlington County in additional ways to those that they had before.
From the time an incident or an injury or traumatic event happens to a patient is effectively given something called a golden hour of opportunity. And what that means is anything that happens outside of that golden hour will decrease their survivability, chances. And so having the Level 2 Trauma Center in Arlington, Virginia gives us a great advantage to work against the clock.
So a lot of the equipment that we have is, as you can imagine, very expensive. The foundation has provided us with funding for several critical pieces of equipment in the trauma bay, as well as in the hospital to care for trauma patients.
When we transport our patients to the hospital and we are engaging with the nurses and the doctors, it is hugely beneficial for us because we're interacting with our colleagues that we see on a regular basis. We have a previous rapport with them. So it's advantageous for our patients because it's such a seamless working relationship.
From a practitioner standpoint, I think having a trauma center definitely is enticing in that we care for a special group of patients. We have a tremendous sense of team, and we all look forward to the outcomes of getting people back to their regular lives.